Have you strained your back lifting and you have pain that stays in your low back but doesn't go down the leg? Then follow this routine. Start by doing wig wags. So lay on your back with your knees bent up and rock side to side. Go in a comfortable range of motion and slowly start to progress how far you can go as comfort allows. You should feel a little bit of stretch through the outsides of your hip. And if it's painful at first, start small and then build into a bigger range of motion. You want to go 10 to 20 times each side. Then stretch it into a child's pose. So you want to have your hips reaching back for your heels and your hands and arms pressing towards the ground. Then progress into a side child's pose. So walk your hands to one side and then kind of push your hip towards the floor of the opposite side and then switch sides. Only hold for about 15 to 30 seconds on each direction. Then lay on your back again and start with some pelvic movement and some breathing. You want to make sure you're breathing and expanding through your diaphragm, not your chest when you're breathing. This will also help with lifting and controlling your breath so you're not bearing down or just using your chest to breathe. So you're going to breathe through your diaphragm and tilt that pelvis just to create some movement in the low back. This should be very relaxing for the low back and not create a lot of pain. Next, you want to work on some isometric muscle activation because pain shuts down our muscle function. So you're going to make sure you have a nice good breath through that diaphragm again. You're going to squeeze your glutes and squeeze your tummy and be able to breathe while holding these isometric muscle contractions. Now, once you have that, you're going to hold that contraction as you lift your legs up and work on holding there. If that feels pretty easy, you can lift your arms up and hold overhead, all while maintaining a neutral back and isometric muscle contractions and breathing through that diaphragm, so no holding your breath. Once that feels easy and you can hold for about a minute, start kicking those legs towards the floor. Again, no holding your breath, and don't let that low back or pelvis move a lot as you move your legs. Your legs should move without your trunk having to move. You want to perform about 10 on each leg. This is all to teach you how to keep that core steady and control your breath needed with lifting. Next, you're going to go into some more ab isometrics or abdominal bracing with movement. So find your neutral spine and then start by kicking one leg out. Notice how my low back does not extend or flex a lot as my leg moves. I'm holding nice and steady, and then I switch to the other side. I start with one side at a time just so I can get the feel of the contraction with the movement. And then I'm going to move into one leg and then alternate the legs so I can feel how my core and trunk has to be engaged to move my legs, but I still have the support of my arms. For these, I'm performing about 5 to 10 reps on each. And then I go into same side, opposite arm, and leg lifts. This is more like your traditional bird dog exercise. I have a little bit of a pelvis rotation, but not much, and you want to keep it as stable as possible. So if you were balancing a cup of water on your back, it wouldn't spill out or fall off your back. Now, the last version of this is alternating legs and arms. So once you have pretty good feel and no pain for the exercises I just showed you, you can now go into alternating. This is a great way to warm up. So now we got to get the obliques and glutes firing. So we're going to start with a side plank. If you're still in pain, you might want to start with a Side plank on your knee or even one knee just to get those hips lifted, making sure your back is in a nice neutral position before progressing to both feet on the ground and no knees helping you. Again, when you perform this, you want to maybe start on the knees, making sure your shoulders and hips, you don't want your hips behind you. You want to be in a nice line, and then progress to one foot and one knee, and then progress to no knees and just feet again in a nice line. You don't want your chest falling or your hips out. Nice stable line. Helps support your core and your low back. Then we're going to go into some loading in different like squatting position. So this is called a multifidi squat. So we're going to take that same neutral trunk position you've been working on the floor, and you're going to be against the wall in a wall sit. So challenge yourself on the depth. So if you need to be a little bit higher up because of pain or weakness, that's fine. And then you're going to lift your arms overhead, kind of like doing the bird dog exercise, except now our legs are stable and the arms are moving. Your trunk shouldn't move on and off the wall as the arms come overhead to touch the wall above you. And a progression of this is sitting even lower, so maybe your hips are slightly below your knee, as if you were to be in a full squat. And again, bringing those arms. You can do this for time, 30 seconds to a minute, or you can count repetitions of arms, 10 on each side, for the duration of this exercise. Next, we're gonna go into a hip hinge. So if you have pain with like a deadlift or things like that, this is a really great exercise to practice. So you're gonna start with your hip or your feet just maybe wider than hip distance. Put one foot back. You should have a little bend in your knee against the wall, and then you're gonna slide your hands down your legs, pushing your hips into the wall, keeping your core nice and neutral. All the movement is coming from your hips and your knees, not your back. As you can see, my back stays pretty even throughout the whole movement, and I'm just moving through my hips. If the hand sliding down the legs is easy, causes no pain, try crossing your hands through your chest or even crossing your hands behind your head to change the lever arm a little bit. This makes an increased challenge. Also notice how my shins stay vertical and my back stays flat the whole time. I'm building tension through my legs, hamstrings, and hips. I'm using that tension to drive my hips up, bringing my chest up at the same time. And I'm not overextending where my shoulders end up behind my hips, because that can also create strain. Once you've progressed or gotten the wall exercise, take a dowel and then notice the points of contact. I have a little bit of gap in my low back, and I want to maintain that as I hinge over a box, and then I hit my thighs on that box as I come through. Again, I'm keeping a neutral back, moving through my hips, keeping the points of contact with the dowel the same as I bend forward and come up. I don't increase points of contact, and I don't decrease points of contact. Now, we're gonna go into a deadlift. So you're gonna take the dowel, and you're going to start at the top, and you're going to slowly bring it down your legs in that same motion you've just been working on. If you want, you can start in a short range of motion. So just go to the knee, making sure there's no pain there, and then drive those hips back up. And then as you feel more comfortable, you can go further down on the leg. After you've been working, it's good to open up the posterior chain and stretch out the legs. So if you're really sensitive, you can start in seated, and you're gonna press your arms into your thighs and lift your hips to the sky, and then reach your hands to the floor, place your forearms back onto your legs, and sit down. And you're gonna repeat this. If you're not as sensitive, you can do this without a seat, but same thing, you're gonna start in a squat, pressing your arms into your thighs, and then as you press, you're going to lift your hips to the sky until your hips get to the sky and your legs are extended and your hands drop to the floor. Then press your arms back into your thighs and sit back down into a squat. This is a really great release for your back of your legs and your low back, especially if you are sensitive to pain in the back with lifting. Follow this plan and improve your lifting.